Hi, I'm Dr. Fareen Karachiwala, Associate Medical Officer of Health for York Region. Today, York Region opened our vaccine drive-through clinic at Canada's Wonderland. This location lets people with an appointment check in, be screened, receive their vaccine, and be observed for 15 minutes after their vaccine, all without getting out of their vehicle. It's an ideal option for homebound individuals or people with mobility issues who could find it difficult to attend a static vaccination clinic, which requires some walking. For those attending the clinic, please complete the online screening ahead of time, arrive on time, bring your health card and identification, wear a mask and a short-sleeved shirt, leave your pets at home, and bring a pen, water, and snacks. As with all York Region COVID-19 vaccination clinics, appointments are required for this clinic and can be booked by visiting york.ca/COVID-19 vaccine. York Region continues to drive its mass immunization plan forward by building on the more than 140,000 vaccines that have already been administered. Nearly 80% of our 80-plus population, 60% of people aged 75 to 79, and nearly 20% of our 70 to 74 age group have been immunized so far. This is fantastic progress and puts us ahead of the provincial plan. It's our hope to continue at the current pace in the coming weeks, with the goal of moving down the 5-year age brackets every week to 10 days. Our aggressive efforts to vaccinate as many residents as possible is essential as COVID-19 variants become the dominant strain. In York Region, variant cases now account for about 60% of the daily reported cases. What's really important to know is that only 1 in 10 of our variant cases are found in the 70-plus age group, and the bulk is in the younger populations. We are seeing the highest number of variant cases in our 20 to 50-year-olds, and we are seeing some hospitalizations and, very sadly, some deaths even amongst younger people. Vaccinating younger age groups in hotspots will help curb the spread of the variants, and York Region Public Health is currently exploring targeted immunization strategies. We are still very focused on vaccinating residents at highest risk of COVID-19, like our seniors, and moving down in 5-year increments. These efforts will happen simultaneously. So if you are a resident of York Region, age 70 or older, or are currently part of another eligible priority group, and you have not yet received your vaccine, please book an appointment as soon as you can. All vaccines in Canada are safe and effective at preventing symptomatic infection and serious illness. There is no need to delay or wait for one vaccine over another. We are amidst variants and high case counts. The more people we have covered with at least one dose quickly, the better off the whole community can be. Also, given that a lot still needs to be done in terms of vaccinating our younger groups who are at risk, especially of the variants, it is crucial that we all remain vigilant and continue to follow public health measures, whether we've gotten our vaccine dose or not. We are not at the point where enough people in the general public are vaccinated, so we do have to continue to abide by our usual COVID-19 advice. York Region remains in the red zone, and we need people to please continue to respect the rules. Wear face coverings indoors, maintain distancing, limit time with anyone outside your home, make use of the nicer weather and spend more time outdoors than indoors. And please watch closely for signs and symptoms, and go get assessed and tested and self-isolate at any sign of COVID-like symptoms. We know other countries have loosened some of their rules because they are in a very different position than us. In Ontario and in Canada, we are just not there yet when it comes to the number of people vaccinated, and the risk remains. Let's not undo the progress we've made. Please continue to pay attention to public health advice, especially as we move into the long weekend and with a number of religious and cultural holidays upon us that we wish everyone all the best for. You may have seen that this past week, our Medical Officer of Health, Dr. Kurji, issued a Section 22 order banning the use of hookah in York Region establishments permitted to be open. This is because there is increasing evidence of the risk of using a hookah on COVID-19 transmission due to close contact, sharing mouthpieces, and the like. This is also a good reminder that, in general, use of things like tobacco smoke in particular, and also likely vaping, can make people more vulnerable to COVID-19, including its more serious effects. If you want to learn more or are thinking of quitting smoking, now is a good time. And you can learn more by speaking with your healthcare provider and visiting york.ca/quitstories. Finally, thank you to all of our residents for being patient. We have to do our best to be compassionate and kind to one another, to our communities, and to all those working really hard to control the pandemic. Our staff are working day and night. They deserve our utmost respect and compassion. They are doing their very best to serve the community. Please, if our staff reach out to you in their work, whether it's through vaccinating, through speaking to contacts of cases or cases themselves, be forthcoming with information. We maintain a very high standard of confidentiality and privacy and are not here to judge, just inform. We keep our interviews short and focused and really require everyone's cooperation and patience at this time. As always, thank you to all of you. Stay safe, stay informed, stay kind and compassionate. We will and are getting through this together.